So this is the NIHR Senior Investigator webinar on applying for the NIHR Senior Investigator Award and how to put forward an excellent application for this particular award. Um, so just to introduce myself, my name is Sarah Kutub. I am the Senior Program Manager at the NIHR Academy, and I'm part of the team that manage the NIHR Senior Investigator Award. Along with me today, we have on our panel Professor Catherine Pope, who is Professor of Medical Sociology at the University of Oxford and is the overall chair of the NIHR Senior Investigator Funding Committee. We also have with us Professor Martin Orell, who is the co-chair of the NIHR Senior Investigator Subcommittee for Medics, Dentists and Public Health, and he is director of the Institute of Mental Health, University of Nottingham. Also have with us in the webinar my colleague Claire, who is managing the Q&A function in the chat boxes. If you've got any concerns as we're going through the webinar, any urgent queries, please feel free and Claire will be able to help you out. In terms of the agenda today, I will provide a brief overview of the Senior Investigator Award and the Round 19 funding opportunity, which has just opened, and walk you through the application process and changes to the award that have taken place this year. And we'll then invite panelists, both our chairs, to talk about the application and what their expectations are as funding committee members and their particular perspective on what you can do to put forward a particularly strong application for this very competitive award. And we will then have time at the end for questions and answers. So we'll pick up the ones which were submitted prior to the webinar and also those that you submit now. In terms of our aims for the webinar, we hope to be able to clarify to you what our expectations are from applicants for this particular role, the process and timelines for the application, and what the funding committee are looking for within the applications. So firstly, with regards to the award itself, who and what? So this particular award from the NIHR, it recognizes the most prominent and prestigious researchers of applied health and social care. Senior research investigators are really very influential senior research leaders who are influencing national research plans. They are really the most active leaders within the NIHR research community, and that's something we want to really underscore, and that will hopefully become evident as we talk through the application process, how important that aspect of leadership within the NIHR research community is. We expect them obviously to be leading impactful health, social care, and public health research, but beyond that, to also be acting as mentors and role models for early career researchers, but ambassadors across the health and social care systems, and to be involved developing research capacity and talent in underrepresented groups and specialities as well. So based on that, in terms of the broad remit that we expect and the kind of things that we expect senior investigators to be involved in, who is a good fit for this role and who should really be looking to apply for this particular award? So we are looking for exceptional and ambitious research leaders who are keen to expand their work with the NIHR, with the DHSC and the wider sector to tackle complex issues. I just wanted to sort of highlight and underscore how this might be distinct from other offerings that we have at the NIHR and other awards that we offer in our fellowship awards, where you might not necessarily have an ongoing relationship with the NIHR. But in this particular case, we are talking about research leaders who already have that relationship with the NIHR and are really looking to embed that relationship further and to take it forward. So we're looking for ambassadors who are committed to continuing to support the NIHR and researchers who are working across the broad remit of the work that the NIHR funds. But we do have particular priority areas that we're really looking to increase the strength of our senior investigator community in. So those are around social care and public health. And related to that, we're particularly interested in calling forward applications from professionals such as nurses, midwives, allied health professionals, methodologists, social care researchers, healthcare scientists, and pharmacists. These are really priority professional groups for us, and we're very keen to support applications from these groups. So one important update to bring forward to everybody today, which you would have seen if you've had a chance to look at our website and our guidance information related to this award already, is that the Senior Investigator Award is being expanded from around 19, this cohort onwards. So new to this cohort, what we'll be doing is that the award will now be open to researchers from Northern Ireland as well. So up to 2 senior investigators from Northern Ireland will be awarded as part of this cohort. And going forward, this is part of a bigger systemic change that's taking place across the NIHR senior investigator community. So, senior researchers in England, who are known as the NIHR senior investigators, those in Scotland, the NHS Research Scotland network leads, and those in Wales, Health and Care Research Wales senior research leaders, they'll now be brought together as a community of senior investigations. So we will now be sort of working much closely together with our colleagues across Scotland, Wales, and Northern Ireland, and there'll be a lot more cross collaboration that we'll be seeing across the NIHR senior investigator community. I do want to kind of sort of mention here that Scotland and Wales will continue to manage and administer their schemes for network leads and senior research leaders, respectively, at the moment. The NIHR is only going to be managing and administering awards for applicants based in England and Northern Ireland. So just to clarify the process change that's taking place. Lastly, with regards to who are we asking to apply for this, we really want to underscore that we continue to review the diversity of our senior investigators. That's a very important perspective of our sort of application process. And we're really sort of key to keep an eye on the social demographic characteristics, the professional methodological backgrounds of our applicants, and to encourage applications from underrepresented groups. And I know that the chairs are going to be talking about this in further detail about how this is something that they look up across as well when they're reviewing applications at the assessment stage. Now, in terms of the award itself, the Senior Investigator Award is quite different from all of the other offerings that we have with our NIHR fellowships and so forth that you might be much more familiar with. This is very much a discretionary award, and the amounts I just want to draw attention to, they have been changed from this cohort onwards. It's going to be discretionary funding of 15,000 per year for 4 years, and it's as it is a discretionary award, we do have a lot of room for awardees to use it as they see fit. But some of the reasons that can be used for are sort of identified here. They cover everything from travel costs to conference costs to covering costs of consumables. Awardees have very often used this funding for as bridging funds. And to provide any kind of additional support that they feel is valuable to their research teams. So we do encourage you to, use the award monies sort of as sort of creatively and constructively as possible. Now, moving on to this particular funding opportunity, which has been launched yesterday, there are some changes that have been made in this round. We just want to use this webinar to draw your attention to them. Hopefully, that will help you navigate the application process more smoothly. Firstly, with regards to award guidance, this all is now available on the NIHR website. The main ones to draw attention to are the award page, which has details of the Senior Investigator Award. It has details of the whole award setup, including some sort of testimonials from existing award holders, previous award holders, links to a lot of the activities that senior investigators are involved in. So it really gives you an overall flavor of what the Senior Investigator Award is. And then the other important sort of, if I was to think to signpost you on the website, is the funding opportunity pages for Senior Investigator Cohort 19, which specifically speaks to this funding opportunity. And it has links to the application guidance, to the application forms, and all of the details that you require to be able to submit your application. So I'd strongly encourage those who are interested in putting forward an application for this round to, have a look at the at the NIHR website. And we are very mindful of the fact that because the website has undergone sort of significant change this round, information might look very different from what it has in previous years. So if you have any difficulty sort of navigating that, if you're looking for bits of information around the award but aren't able to identify where it is on the website, please feel free to reach out to the team, and we're very happy to kind of walk you through all of that. There are a couple of things that I want to sort of, briefly sort of touch on, which are important with regards to the application process. Firstly, it's with regards to the eligibility criteria. We've distinguished the eligibility criteria for applicants who are based in England and applicants based in Northern Ireland just to make the process easier for everybody to navigate. But the important things for applicants based in England is to note that there has to be a substantial contribution to the NIHR with ongoing contribution planned. We get this question very often every year. What counts as contribution to the NIHR? So that now has a detailed web page on the website, which details what those roles could look like, which would count as contribution to the NIHR. And I know our chairing panelists are going to be valid contributions to the NIHR. Applicants must have part or all of their salary funded as a research cost from the NIHR. Just want to note that if your salary is being funded as a core cost or a sort of a match funding by an organization which has an association with an NIHR infrastructure award, then please contact us before putting forward an application because we would need to discuss the details of that with you. Apart from that, all sources of eligible NIHR funding are detailed on the website as well. So there's further details around what is eligible funding from the NIHR, but only to note that it must extend beyond the 30th of June 2026 for you to be eligible to apply in this particular cohort. Obviously, for applicants based in England, they have to be employed by an organization based in England. And NIHR Global Health research professors are also able to apply for the award as long as their terms end by the 1st of April 2026. For applicants based in Northern Ireland, they must have made meaningful contribution to the delivery of Northern Ireland's strategy for research and development in health and social care research. They have to be employed by an organization based in Northern Ireland and have to be able to demonstrate a track record as a chief investigator or lead applicant on significant research grants funded by Health and Social Care Research and Development Division, the Research Councils, NIHR, or other high quality funding bodies. If you're an applicant based in Northern Ireland and you're looking to make an application for this award, we would require you to contact Dr. Saoirse Finnegan at the email address given here to discuss your eligibility before starting an application. Now, the most important thing, I suppose, to draw out with regards to the application process is the assessment criteria. And to just clarify what these are, I won't go into too much detail around each one of them here, but it is to essentially say that these particular assessment criteria are all details in the guidance notes for the award. But the most important ones from the funding committee's perspective are the contribution elements over here. We expect successful applicants to demonstrate excellent leadership in all 5 criteria, but the funding committee are not able to recommend an application that does not demonstrate a significant personal contribution to the NIHR or equivalent bodies, regardless of scores against other criteria. We hope that kind of underscores how important the contribution element is as you're putting together an application, and that is something that we strongly encourage applicants to really focus on when they're thinking about their application and what to put forward in it. Apart from the contribution to NIHR and contribution to other equivalent bodies, the other key assessment criteria are working with people and communities, which was previously what we referred to as patient-public involvement. So being able to demonstrate a significant track record of working with people and communities is another assessment criteria. The third assessment criteria is around research impact, where we expect applicants to be able to demonstrate a strong record in contributing to NIHR growth, being able to demonstrate research leadership, being able to show a track record of engaging with health and social care commissioners or policymakers, so external engagement, and relevance of their research portfolio, which either translates into improvements in outcomes for service users or improvements in efficiency of the health and social care system as a whole. The next assessment criteria is contribution to capacity building. So we expect applicants to be able to evidence strong track record in supporting researchers and developing them at all levels. So that includes regional and national levels. And then the fifth assessment criteria that we've sort of tried to draw out further this year and hopefully clarify because it is such an important part of the application is that applicants must clearly detail their proposed future activity or activity from the first award. So this is obviously differentiated based on the nature of your application. So if you are applying for your first award, then we would expect a clear description of the activities that you would undertake in line with the expectations of a senior investigator and what kind of activities you're going to undertake if you are given the award. If you're applying for a second term as a senior investigator, then we expect a clear description of the contribution that you have made in your first term and the activities that you undertook, and then how your second term will build on those activities. An application for a second term award, which is very similar to the first term application, without much evidence of additional NIHR contribution, is unlikely to be successful. So those are the five main assessment criteria that we have for this award that all applications are going to be judged against. Now, in terms of the applications process, we have now migrated over to a new award management system, which is linked to in all of the guidance documents. So just want to kind of highlight that to individuals who may have applied for other NIHR awards or fellowships. We are no longer on Aramis, which you might be familiar with and have accounts on. So you would need to now log in and set up a new account on the system to be able to submit an application for this award. The application form itself is quite a simplified offering going forward. It has four main sections, and we have a summary section followed by a section where you provide all of your lead applicant details. There is a section in there on contextual factors, which we would encourage you to make use of if there's any that you would like to draw forward to the committee's attention, and also a section on there on highlighting the eligible funding that makes you eligible to apply for the award. The main section on the application form is the section 3, which is uploads, where we now have a number of templates which you would need to download, fill out, and then re-upload to the application system. I appreciate that it all sounds sort of quite complicated, but the award management system has been set up to really just ensure consistency across all of the NIHR offerings. So for the Senior Investigator Award, we have built-in flexibility by putting in these templates, which applicants are able to download and fill in as best as they see fit. So with regards to the case for support, that's the primary template that you'll be using to submit your evidence against the 5 assessment criteria, which I've just identified. The template has indicative word counts for against each criteria, and we very strongly encourage applicants to try and adhere to those indicative word counts. There is a sort of strict page limits, and the system would not allow you to submit applications any longer than those page limits. So please use those recommended word limits as a good steer for how much information you should include within each category. We do discourage the use of hyperlinks and URLs, so please do not include them as a way to kind of bypass the word count, as that's not something that the funding committee look favorably on. And then the other uploads, which you would need to complete and then sort of submit as part of your application, are a letter of support from your contracting organization and an eligible funding confirmation letter, which is not a necessary upload but only applies in certain circumstances. And we have lots of guidance around when you would need to use that. And that's essentially the application form in a nutshell. Just lastly, just want to finish on some key dates just to draw those to attention. These are also detailed on the website, but just to say that applications for this round close on the 8th of September. We then enter through our review and assessment period, and the funding committee makes its recommendations to the DHSC, and we are able to notify applicants of outcomes in February, towards the latter part of February 2026. This award has a sort of uniform start date. So all awards start on the 1st of April 2026 for cohort 19. And the last thing I want to draw attention to is 2 meetings, which we expect all awardees from round 19 to attend. And this is really part of the expectations that we have of new awardees. One is an induction meeting for all new award holders, which takes place on the 19th of May 2026. And this is attended by sort of senior leadership from across the NIHR as well as DHSC colleagues. And then we have a joint meeting of all of the senior investigator award holders are at Senior Investigator College and research professors, and that's a meeting that takes place in October 2026. We'd like to just draw, sort of applicants' attention to it at this stage so that you're aware and sort of can think about your availability to attend these because you would be expected to if you are given the award. So that's sort of a quick sort of whistle stop tour of the whole application process of this particular funding opportunity. I'm happy to take any questions around the process and any kind of details around how to navigate the application process at the end of it. But I'm going to hand over to Catherine now to just talk about the funding committee chairing team's expectation and their perspective on how to put forward a strong application.
Thanks, Sarah, and welcome everybody. It's lovely to see such a nice large group of you here, and I recognise some names, so hello to people that I've collaborated with or work with. So I've been involved with the Senior Investigator Committee, particularly through a role on the Social Care Committee, which is one of the newer arms of NIHR funding, and is a really great addition to our Senior Investigator community. And my co-chair Martin takes particular responsibility for the medicine and dental committee, but we talk to each other, and a lot of the ratification process and it involves looking across all of the committees and their decisions. So I'd like to make sure that we leave a lot of time for questions, because I think the most useful thing here is to hear from you about the things that you don't know. So just some kind of top tips from me from listening to the deliberations of our panels and looking at all of the applications that have been made over the last few years. One of the big mistakes that people make when they put an application in is they assume that if they're doing great research and great science, that we will give them this award. And they may be doing great research and great science for all sorts of other funders that are not NIHR, and they may have lots of very important roles in government, internationally, in WHO, etc., etc. And those things are all important, and obviously they're very important to the research and in the higher education institutions that you work in. But I want to really, really emphasize that this award is for what you do over and above those things for NIHR. It's about demonstrating that you're making an additional contribution, often a voluntary, not paid for as part of your salary contribution. So you may be running an NIHR program grant, or be a co-op on a number of project grants, but those things you are being paid already to do for NIHR. So we are looking for the contributions that go beyond that. And some of you may be leading themes or leading some of our infrastructure like BRCs and ARCs. And again, we recognise that those particular leadership roles often have a commitment that goes beyond the percentage of your salary that is allocated to being the director of the BRC or whatever. But the key thing is that you show us in the paperwork what it is you are doing that is in addition to that time commitment and salary payment that you're already receiving. So that's one of the big messages that I want you to take home from today. And I suppose the second message I would ask you to take home is, don't assume we will use knowledge that's not on the form. We need to see evidence on the form that you are doing the things and meeting the criteria that are specified there. So I do not look at the web links that are embedded in the form. I look at what is on the form, and we discuss what is on the form and what you've told us about what you are doing. And like many of these assessments against criteria, the really important thing is to show us some evidence of that. So a sentence that says, I have a strong commitment to capacity building for the next generation of researchers, is a nice opening sentence, but we'd like to know how you demonstrate that, because the better applications will tell us exactly how that person has developed people. And the third thing I want to say, I think, before I hand over to Martin, is that what we are now calling patient and community engagement and involvement used to be called PPIE or PPI, patient care users, carers, public involvement and community aspects of what we do. That is reviewed by public lay committee members, and it is equally weighted in the process. So like all of our NIHR funding, the voice of patients and service users is taken into consideration, and you need to be aware that we look closely at that, and we rely a lot on our lay colleagues to help us do that. I think we can talk a little bit about second term applications, perhaps when we see where the questions are coming from, because if many of you are first time applicants, maybe we want to focus initially on that. And my very last tiny thing is the uploads in the new system. I have noticed from doing a different application recently that if you are ever given an option to upload a Word file or a PDF, I would suggest you upload a PDF, because certainly the last time I used the new system, it converted the Word file into a different font and made it go over the page limits that were set. So if you've set it out all very nicely and made it look lovely, I suggest you PDF it and upload it as a PDF. So that's just a kind of little bit of kind of using the new system. So I'm going to shut up there and have a focus on the chat while Martin tells you the things that I haven't told you.
Hi. Hi, thanks very much, Catherine and Sarah. Just see if can people see me okay? Yeah. Good, okay. So that's, I think, very helpful introduction from Catherine and Sarah. And I'll just add a few bits and pieces. One thing is the raters read quite a lot of these. So make it nice and clear, well set out and easy to read. So people get it immediately. They get the points that you've done. They get your achievements. Sometimes people find bullet points useful, or 3 or 4 main points per section. I'd stick to the key things in each section which are going to make a difference. Make sure you've got specific points and specific dates to go with them. People are going to look at when you actually did this. And one thing about it that people have said is that you might have a brilliant application, you might have done brilliant science. They're all brilliant, and it's called NIHR Senior Investigator for a reason. In relation to the capacity building, if you can show people going through the trajectory of capacity building, if you've had, for example, if you've had 5 PhD students who've then gone on to be associate professors and professors, so you've actually developed people and you're contributing to, the next generation of leaders, I think that's very helpful. You can, sometimes people even name them to say, this Professor so-and-so who was my PhD student, we supported in this way. So people like detail, and it makes it easy to read and easy to rate. I guess the other thing to say is, if you can get feedback from a senior investigator that get comments, get feedback, see how it reads, and you may not be successful first time. I think a lot of people have, get a successful second or third time. So I'm very happy now to take questions. Thank you.
Brilliant. Thank you very much, Catherine and Martin. We'll move on to the questions and answers now. And we have quite a few sort of questions that we had submitted prior to the webinar. And so we can start with those, but then we also have some questions which have come in the Q&A box now. So we try and rattle through as many as we can. So first question that we had was sort of submitted prior to the webinar, and that was about how broad or detailed yearly plans need to be. So I think this refers to the section where applicants are asked to sort of provide a bit of context for what they would do if they were to receive the award, and they've asked for how much detail they should provide in this particular section. So Catherine, Martin, if you'd like to respond to that, please.
So is that a question about their if they're coming for the second time round and their future plans?
Yes, for their future plans, or even if they're a first-time awardee, how they're going to be using the award.
Well, I think they have to look at the word count they've got available. I think some key points. I think mentoring always goes down very well if people are mentoring and developing other people. Thinking about what you might be doing in your department, helping, you could be supporting people to make NIHR applications and develop. Think about what you might be doing in relation to grants committees or other leadership roles. And I guess in some ways it relates to also what we're looking for in terms of the NIHR contribution so far. But it's about looking to the future and thinking how you'll use it, and how you'll make a contribution in the new role.
And I suppose I would add to that, just keep an eye on the NIHR strategic focus in terms of things that NIHR are particularly keen to develop. So, we've mentioned the patient, service users and community aspects of NIHR work. That's very important to everything that we do. So things that you do in that space will be valuable, but there might be particular calls for work and leadership opportunities in areas where NIHR have identified that there's particular health need or need for capacity development, for example. So do show how you would use the award to make those sorts of contributions.
Yep, that's excellent advice from Catherine Martin on that. Second one, I think, and you mentioned this briefly, Catherine, was any specific advice on second term applications?
Okay, right, we will do the second
So
term.
we addressed
Okay.
that.
So the thing about second term applications, I would say the complacent approach was, I've had one of these, I'm wonderful, I'm a senior investigator, I just have to copy and paste the form from last time and they'll give it to me again. And I'm afraid that's not how it works. In some ways, the bar is probably a little bit higher for second time because you've had this opportunity. So we want to see what you've done with it. And it is not the moment when you get the Senior Investigator Award, that is not the moment to resign from all of the voluntary committee work that you're doing, or to decide that you can't be bothered to do any more capacity building for a period. You really have to keep up with the things that got you the award the first time, and probably demonstrate that you've taken it up a notch, which I realise is a big ask, and not everybody gets the second award. So again, it is as competitive as first time round.
Martin, is there anything that you'd like to kind of add to that?
Can I agree with Catherine?
Yeah, brilliant. That kind of covers it. Yeah, absolutely. Right, now this is another sort of question, so it's slightly sort of forward on from the application process itself, but I think it's useful to kind of give some perspective on this. So this particular individual was querying how are sort of applications kind of ranked, and how does the committee decide on what applications are fundable or not? So if you could maybe share some thoughts around the process that the funding committee deliberations go through, I think that would be useful for people to hear.
Okay, so I could start that, and Martin might give you some additional insights from chairing the medicine and dental panels. So much like the funding awards, the applications are sent to the committee, who read they read all of them, but they read a number of them in detail and are prepared to attend the meeting and comment on those. And each of the criteria are scored, and we are given these incredible spreadsheets that our wonderful colleagues in NIHR in the Secretariat prepare, which are these huge Excel spreadsheets that show us every criteria, show us all of the rankings that individual reviewers have made. So there are 3 academic or professional reviewers. There are the PPI reviewers, and again, there are 3 of them. And we are shown the individual scores for each criteria for each reviewer, and we are shown the mean of those, and then we are shown total scores. And we look for excellence, so top scores across all of the criteria. And if somebody scores a straight line of top scores, then there is probably minimal discussion of their particular application, because it's clear that everybody agrees that those are scored very highly. And then we scrutinise all of the applications where there are some anomalous reviews that are not following the trend line. So you could have a number of excellent scores, and then perhaps you are marked as perhaps not making a contribution to patient, carer, and service user and community engagement, for example. And we would scrutinise that and look at what's written on the form and look at the reviews and the comments there, and make a decision about whether the reviewer was perhaps being a bit harsh or had not noticed something that is actually clear on the form that one of the other reviewers has looked at. So those are scrutinised in that way, and often there's a very careful and considered discussion of those cases. And I would say that the people that score very low on all of the criteria, they do not get hours of scrutiny, because we have to go through this process very, very quickly, or rather we have to go through it efficiently on the day. So if you score very low on everything, we are not going to scrutinise your application, because we feel that everybody is in agreement that this is not a strong application at this stage. So the discussion is often around the middle. And then at the end of each panel, there is a process of re-examining those and ranking them in numerical order. So the strongest ones at the top, and the ones that we think are maybe borderline are flagged, and we use colour coding systems. So we have, green for the ones that are a definite yes, and amber for the ones that we just want to return to. We also flag, and our Secretariat colleagues are brilliant at helping us with this, we flag things where there has been a particular discussion about, for example, circumstances that might mean a person has had different kinds of opportunities. So, for example, somebody that's had significant disability or impairment, or has worked part-time during the period. So we might flag those things just to make sure that we're not doing a disservice to those applications. And then the difficult bit for Martin and I is that we have to chair and oversee the process of bringing together all of the panels. So we have the methodology, we have the nursing, midwifery, allied health and methodology panel, we have the medicine and dental, and we have the social care panels. And at the very end of the process, we have to bring all of those together and rank everybody and be really clear who we will recommend to the Department of Health and Social Care to go forward. And I would say that exactly the same as with research funding, we make a recommendation, and it is in the gift of the department of health and social care to decide whether they agree with our ranking. And we're very clear that we are not expanding the college year on year. So there is a sort of one out, one in process. We cannot really flex the numbers. I hope that's covered everything.
I think Catherine's provided a lot of detail into how the whole reviewing process works. So hopefully that should, give you all a very good flavor of how the deliberations work and, the amount of work that goes into sort of reviewing all of these applications and then making recommendations. Martin, is there anything that you feel needs to be added to that?
Just to say that your PPI and community section needs to be really good because the reviewers are really experts and outstanding in their field, and they can tell what a good one looks like quite quickly. And so where you've got strong support from the PPI raters, that's really a great help. And I just go back to say, make things easy to read. And the group who come top are just outstanding. So even then sometimes there's difficulties in actually some of the discussions. So it's try and make it as fair as possible.
Absolutely. Brilliant. So I'm going to move on to some of the questions that have been submitted in the Q&A box, and mindful that we've got quite a few. So we'll try and get through as many as we can today during the rest of the time that we have. So the upvoted question that I think a lot of people are interested in is in the letter of support that I mentioned that you have to upload as part of your application. So the question that's been asked is whether the letter of support is assessed by the committee as part of the application or simply as an indication of institutional approval. And I think there's another question later on about the letter of support, whether that comes from the institution or whether that can be from other key organization or agency supporting the application. So I can answer it from the application program perspective. So this particular letter of support is meant to be submitted by your sort of employer organization, and that's really meant to indicate that they sort of confirm their support for you to undertake the role of the NIHR Senior Investigator. That's the primary purpose of the letter of support, just to confirm their support for your application, and that to say that they are happy to, sort of be the body to administer the funding for the award, were you to receive the award. And you do not need to submit a letter of support from any other kind of organization in support of your application. The second
Can
one
I just,
is,
yes, sorry, can I just
Martin.
add to that, Sarah? So it's really just to confirm things. You don't need an effusive letter of support. It's really just to say, yes, they'll support you. They're happy with the application.
Yep, precisely. The other question that we've got here, so it'd be great to kind of get your input on that, Catherine, Martin, is how do we define and measure impact in research outputs, particularly in the context of the senior investigator selection process? So what are we looking for in impact in the context of this particular award?
Catherine, shall I go first, or do you want to? Okay, yeah. So I think there's a range of things related to impact, particularly if you've done something, you've developed something which has been implemented on a wider scale, something that's been cited and perhaps used internationally is very important, something where you've changed practice. So there's a range of, quite often there's specific things that people have done that have had an impact in practice and have been employed and used more widely. There are other things in relation to impact. For example, people do look at some of the research grants and references and things like that, but also impact on policy. If you've done things that have influenced policy, so it's a range of things, I guess, that you'd expect. Both the kind of, like for the ref, you're looking at the impact in terms of how practice and policy has changed, but you're also looking that you've published really, really good, important research. It's been recognized as such. Catherine, do you want to add?
Yeah, I suppose just thinking about some of our colleagues doing funded clinical work very much in partnership with industry. We sometimes see applications that make it clear that in terms of our agenda for contributing to the economic growth and wealth of the country, that the work that they have been doing and the leadership roles that they have had have helped grow those kind of economic indicators, I guess, you know. So in terms of perhaps working with a small and medium enterprise that has developed something that you have advised on or supported and seen it through, so that that company is now employing people or producing let's say diagnostic tests or something that are helpful. And we sometimes see those sorts of additional bits of information about what people have done.
Brilliant, thank you. So let's look at some of the other questions that we've got. So yes, there's one question about changes in CV that we need to provide. Before it was 10 key outputs and funding. So yes, so just to respond to that, we no longer require you to provide a narrative CV. The application form now links to your ORCID profile, so a lot of that information is pulled through from there. And we have now detailed in the guidance notes that applicants need to submit 3 key sort of top publications from the past 10 years, and there's some guidance on how you should go about choosing that. So there's been some changes around that. Would strongly recommend sort of reading the application form guidance on the website, which really details all of that information. Again, if you have any further questions on what needs to be included, please feel free to reach out to us. So next question, I think would be really good to get some input on this, is somebody's asked they've not served in any of the NIHR grant awarding committees because they've mentioned that they come from pharmacy and that's their background, but they've supervised a number of professionals. Catherine, I see you nodding. Could you please just sort of give some advice on this?
So I think there are opportunities to serve on committees, and I recognise that pharmacy is a small area, but actually there are opportunities to serve on committees and to demonstrate your leadership in that space. So I think unless there was a lot of other compelling evidence, the lack of that service would probably go against you. So you might want to look for opportunities. You may have methodological contributions that you can make, but you also do fit within the allied health professionals umbrella, as it were, and can contribute there.
Brilliant. I think there's a couple of questions which kind of sort of sit on, sort of around the allied health professionals area. And I'll just sort of touch briefly in terms of, how we kind of categorize the award. And then Catherine and Martin perhaps can speak a little bit more to how these subcommittees operate. So they're very much recognized. They're very important. And as I mentioned, are very much on the priority list of professions that we would like to see applications from. And for these particular professions, we have a separate subcommittee which looks at allied health professionals to ensure that, we recognize that their particular professional journeys might be different from medics and likewise from social care. So that's very much something that the award is aligned to and something that we are trying to constantly kind of, work on and promote as much as we can going forward. So Catherine, Martin, if you'd like to say a little bit more about.
I don't really have anything to add to that, but also just to note that we are constantly looking at the diversity of the assessment committee, and I am particularly concerned, and I recognise that we may not be as ethnically diverse as we should be. So there are these methodological and professional areas that we need to represent, but we also need to up our game on how we represent our wider community and populations. So we are taking measures for the upcoming panel to address that. We recognise where our areas of weakness are, and we are doing work behind the scenes to try and change that. But please be reassured that there are voices on the committee that will represent those different perspectives from, this is not about you being judged. I'm a medical sociologist, not a clinician. This is not about going into a room where you're only being judged by people that have done medicine. This is about being judged by people that do have an understanding of the work that you're doing.
Exactly. Anything to add to that, Martin?
I just say that, yes, because that's exactly why the committee, the main panel, was split into some subcommittees, and just really say how important nurses and other allied health professionals are to the NIHR and to all the NIHR panels and things. That we need diversity in a number of ways, but including the professional diversity that we need in order to make balanced decisions that are not just about, medically orientated. So it's absolutely crucial. So we need you, including pharmacy, to join the panels. You bring a lot to the table, and I hope people will be encouraged by this webinar today to apply.
Absolutely brilliant. Thank you. So one further question that I think we've got at the moment, which is about whether there's a time limit for the evidence that they can include, or can anything done during the career be included, even if it was years ago? So I think just maybe so if you can touch briefly on what people should be focusing their attentions on.
So I know that all universities have slightly different and often difficult to work out promotion criteria when you go for the next level up or the next grade up. But that bit where you say, I haven't done any teaching for the last 10 years, but I want this promotion, where one of the criteria is, are you doing any teaching? You know that you won't get promotion in an institution that is asking for teaching and research. It's very like that with these awards. So saying that 20 years ago you once did a bit of capacity building, or you worked with a few patients but you haven't done it since, is probably not helpful. And probably what you need to do is build a story which says, I started doing something 20 years ago, and now my leadership role in that space and my seniority is such that I am able to have a bigger impact, I'm contributing more, and so on and so forth.
And I just add to that, so I agree with that. Also, I think quite often a body of work in research takes a while to do. So the things that actually are building up over time, the initial piece of work might have been done 5 or 10 or 15 years ago, but you're building on that and developing that to give it more of an impact and, make it more relevant. So that, I think that goes down well, but it needs to be building the story rather than, as Catherine said, something you once did a while back.
Yeah, brilliant. All right, thank you very much. I think we're also kind of drawing to the end of our time for the webinar today. So I just want to thank all of our panelists, but I'll go to them both in a minute just to take final words from them. But ahead of that, I just want to kind of mention that we have all of our contact information available on the website, and to say that all of our team are available for you to reach out to if you'd like to have an informal discussion about your application. We're very happy to support that and to make time for that. If you've got any questions about the guidance or the application form or the application process as a whole, please feel free to reach out to us. We'll be holding similar webinars like this over the summer, in particular, also to talk to underrepresented groups, and we'll hopefully have an opportunity to hold a webinar with one of our public contributor panel members as well. So please do look out for those. There'll be information on the website on how to register for those. And I've just seen a quick question coming about about an NIHR board, right? So any specific questions about, your particular application, like I said, we're happy to, discuss those with you in further detail. So before I just bring this to a close, Martin and Catherine, any final words of advice from you both on what you're looking forward to in this round in terms of the applications?
I don't think there's anything extra from me. I've just given a little boost to the pharmacists in the chat so they can see that there are some pharmacists that are senior investigators.
Brilliant. Thank you.
No, I think we've covered the main points. Thanks very much, Sarah and Catherine.
All right. Thank you all very much, and thank you very much for your time this morning.
Thank you.
Take care. Bye.
Bye-bye.
Bye-bye, everyone.